Hello, I'm John Hurst. I'm a doctor and I'm a lung specialist, consultant respiratory physician working at the Royal Free Hospital here in Camden. Although, as you know, we work very closely in Camden, so I've got very close links with the Camden Community Services who put together these series of recordings. We've been working in Camden now for about 12 years, from Lancashire originally, as you might be able to detect from my accent, and I went to medical school in Scotland, but London's my home now really, so I'm pleased to be talking to you today. So what is COVID? Well, COVID is a name for the illness that you get if you're infected by a virus, a coronavirus that has a long name SARS-CoV-2. Lots of people who get SARS-CoV-2 don't even know they've had the infection. They're asymptomatic. But if you start getting symptoms, then we would say you have an illness with that virus, and the name for that illness is COVID. Like all viruses, the coronavirus is changing all the time. And these changes in a virus are called variants. And the importance of a variant is that it might affect the body in a different way. It might be less severe, it might be more severe. It might be less easy to catch, it might be more easy to catch. And because they look different to our immune system, there is the theoretical concern that the vaccines that we have now might be less effective for different variants. That's the reason we have to have a flu vaccine every year, because the flu virus changes from season to season. So when we're hearing about variants on the news, what people mean are a different type of virus that might be affecting the body in a different way, more easy to transmit, or less responsive to treatment and vaccines. And so the government is keeping a close eye on those until we have a deeper understanding of what it means. There are four main ways that you can help protect yourself from catching coronavirus. And they're simple things that we can all do. The first is to wash your hands frequently and specifically to avoid touching your face with dirty hands. The second is to wear a face mask. Actually, that protects other people more than it protects you, but by all wearing a mask, we help to protect each other. The third is keeping social distance, so 2 meters apart from each other, ideally as much as is possible, particularly when we're indoors or when we're in a more crowded space. And the fourth one, and this is a really positive thing to be able to say now, is to accept a coronavirus vaccine as soon as it's offered to you. So the question is, if you get COVID, could that make your underlying lung conditions, such as COPD, get worse? And the short answer to that is we don't know. What we do know is that for people who've got serious underlying lung conditions, if they are unlucky enough to catch coronavirus and get COVID, then it may be that they're more sick. What we don't know, though, at least at the moment, is for those who recover, whether there's any additional lasting damage within the lung. It's possible, but we don't know yet. More research is going on. The question about how you tell the difference between an exacerbation of COPD or a simple chest infection and coronavirus infection is actually quite a difficult one. Some of the symptoms are clearly very similar, so people might get more breathless or more cough, and there's no easy way essentially to tell the difference. So if we're in a period where coronavirus is still circulating and you're worried about coronavirus, the right thing to do is to get a test. Having said that, there are some things that are associated with coronavirus infection which are a bit more unusual in terms of the COPD exacerbation. And the things that are a bit more unusual will be fever. I think that's not common in COPD exacerbations. Muscle aches and pains, which are often a very common feature of coronavirus. And lastly, the disturbance in sense of taste and smell. That would be really very unusual in a COPD exacerbation, but is quite typical in people with coronavirus. So those kind of symptoms might make one more alert that this might not be an exacerbation. But the best thing to do if you're worried, get a test. Let's talk about vaccines and what an exciting thing to be able to talk about. This is being filmed in March 2021. And if you'd asked me this question last year in March 2020 that we'd be rolling out vaccines, I think I would have been astonished, at the very least surprised. The vaccines are all fundamentally doing the same thing. They're training your immune system to be able to recognize coronavirus without you actually having to have the infection. That means if you are unlucky enough to meet the infection in the future, your immune system is primed, ready, raring to go to mount a much more effective and rapid immune response. So they're all trying to do the same thing. But the way they do that is different, and the technology in different vaccines is different. The two commonest ones that we have at the moment are the Oxford AstraZeneca vaccine and the Pfizer vaccine. The Oxford AstraZeneca vaccine is made from a common cold virus called adenovirus that's been modified so it's not harmful, and modified further so that it looks like coronavirus. The Pfizer vaccine, in contrast, is made from just a small piece of the coronavirus genetic material, not DNA like we have, something similar called RNA. But fundamentally they're doing the same job. They're safe. Which one should you have? You should have the first one you're offered. So with regard to which vaccine you should have if you're somebody living with a lung disease like asthma, bronchiectasis or COPD, doesn't matter. They're all similar. There's no evidence that one is any better than the other for people with living with a lung condition. You should accept the first one, and you should accept it as soon as it's offered. Sometimes we're asked by people who aren't sure about whether or not they want the vaccine. And like anything in medicine, it's a trade-off of benefits and risks. You may get some mild side effects. I know when I had my corona vaccine, I had a sore arm for a few days, but it didn't last very long, and it got better very quickly, and it wasn't particularly troublesome. There are some people who can't have a vaccine for genuine reasons. For example, if they have a significant allergy, an anaphylaxis type reaction. But for the vast majority of people, it's perfectly safe and strongly recommended. At the end of the day, it's a personal choice. But if you're living with a lung condition, you are at higher risk of significant problems if you do get coronavirus. So it's not only protecting yourself, but we also need to think about protecting others as well. And I would strongly encourage everyone to have the vaccine who's offered it, unless there's a strong reason why they should. One of the really interesting things that's happened over the past year is that the number of people being admitted to hospital for asthma and COPD exacerbations has fallen dramatically. Here at Law 3, by between 40 and 50%. And that's because when people have been shielded, protecting themselves from coronavirus, they've also been protecting themselves from picking up all the usual viruses which cause exacerbations of chronic lung conditions. And that reduction, that saving of hospital admissions has been greater than we've ever achieved in the past with medicines or vaccines. And so there's a really important question that we need to answer right now. And that's what aspects of these corona prevention mechanisms would people be willing to continue in the long term? Not lockdown, clearly, but maybe washing hands more frequently, maybe avoiding family members if people were actively sick. I don't know, there's a piece of work to do around what people would find acceptable in the long term, but it's been an unexpected consequence of coronavirus that we've seen many, many fewer people with asthma and COPD in hospitals through exacerbations.